Okay, so we'll start with the lower. Like to do the Swift technique here. We start around the corner, we wiped the numbing medicine. Usually the first one is a little bit more sensitive than the others because now we're also introducing a numbing medicine with the first injection, and we numb for the one after. Okay, so have to stay parallel to the skin at a certain depth, not too superficial, not too deep, depending on the filler you're using actually. So what we're using Versa lips, so we don't want to be too superficial. Okay, and always kind of put some pressure so that it integrates with the tissues here, and then we'll continue. And this is called the Swift technique because we're numbing for the next area with each injection. We numb for the area after, because most of the fillers nowadays they have lidocaine, so we're injecting hyaluronic acid and lidocaine. And again, I like to stretch the skin a little bit. That will keep the needle in the correct depth as well, and you can control the flow of the fillers better. Again, more. This blood, that's normal, that's from the skin and the mucosa of the lips, so usually that doesn't cause any, it stops and then it doesn't cause any bruise. The vessels that go bruise, if we actually disrupt one of the usually venous system of veins under the mucosa, and that will cause potential bruise, which is easy to happen actually in lip filler. Not always, but it happens a lot, and it's okay because also the lips mucosa, they heal very fast, and it's easy to cover with a lipstick if it happens. I always tell my patients lips are easy to bruise and easy to swell, but they're also very fast and to heal way faster than regular skin or face skin. Okay, again stretching the skin and continue. The lower lip I go all over from one direction. Sometimes I go back and I add more filler when I go, but I can achieve everything from one direction. Again, I can continue with numbing all around so that I make it as comfortable as possible for the patient when I do it that way. So that's the last injection from this direction, from this side. So the lip is all now kind of more or less numb from the numbing medicine before, and then now from the injections. Okay, like to you massage a little bit, but you don't over massage because you will cause histamine release. So if you overdo massage pressure, then you might cause a lot of more swelling, so you have to control how many injections and how many times and how you do the massaging, so you don't want to overdo it. And then it looks beautiful. I think this should be enough for the lower lip. We injected around 0.4, 0.5 cc, so that's almost half the syringe, more or less. And then we'll move to the upper. Now we finished with the lower lip. It looks really good. And then we move to the upper lip. As you see here, I only wipe the side. Okay, and look up a little bit, and I ask the patients to open their mouth a little bit, not too much, so that I see the lip, and not too much, because the patient will get tired if they really wide open their mouth. It's easier for me, but not for the patient. But a little opening, that's good for both of us, for me and for the patient. Again, we do the Swift technique. I stretch the skin. I'm injecting slow, retrograde. I go back. Sometimes, if you really, in this area or in other, if you are just afraid of blood vessel and you're not sure, what you can do is to stretch the skin the same depth. You can actually aspirate like this and go back, and there's nothing here. You let go, and then you go the same path. Okay, then it's not 100%, but at least more reassuring to make sure that you don't have any blood vessel that you'll be injecting while you're trying to inject the filler. Okay, and then here I'm really kind of superficial, kind of like maybe 1 millimeter under the skin, under the mucosa, I mean. So there should be, the labial artery should be deeper than where I am, so I'm not worried about it. Again, as long as you keep the depth of the syringe. And to do that, again, we'll just stretch the skin so the needle stay at that depth, and I'm, after I go under the mucosa, I go parallel, to the mucosa. I'm not directing any angle, so that I don't go deeper as I go, and I stay at the same depth. Okay, so now to augment the cupid's bow, I like to lift the corner here. Okay, so the way I do it, I take the measurement, okay, and then I go all the way, not too deep, not too superficial again, and then I squeeze. I make kind of the shape, mold it like this, and then I start injecting very slow as I come out. And this technique, I've been using it. I stumbled upon it, I started doing it, and I actually like it. I don't think I remember anyone doing it this way or seeing it. I'm pretty sure like a lot of people are doing it this way, but I don't remember. I learned it just more from experience. And you see it really creates very nice cupid's bow on this side. We'll do the same thing on the other side. And then the other thing for this side, what I do, sometimes it's really hard to get to the angle from the same side, so I go to the other side, and then as a last injection for this side, I do the measurement, and I go from this side here all the way, and I inject, and then this should do it for this side. And you can see the difference between this side and the cupid's bow, and how this is elevated, you see, compared to this side. So we're going to do the same and bring this side, the cupid's bow, the same height, and be more symmetrical. We're going to do the last thing, which is the left upper. So we start with the lower and the right upper and left upper. Actually, even the sequence that I'm doing it is for a reason. It's because the lower lip is not as painful and as tender and sensitive as the upper lip. So we start with the lower lip, and the right side is not as tender as the left side, so I do the left side the last, so that dynamic medicine was sitting there for the longest to make it as comfortable as possible as well. So even this sequence is important. The same we'll do the Swift technique. It might be a little bit, if like I feel I'm a little bit more superficial, so if that's the case, I just inject a little bit less, or I can go out and go in a little bit deeper. Both will do the same purpose, not to over inject certain area and not to cause any bumps. Alright, this is a good depth here, around 1 millimeter for the lips. That's good. I'm always see how much I have in the syringe. I'm injecting. I check the patient before and make sure that we're starting with symmetrical lips to start with, and if that's the case, then we need to inject the same amount in both sides, and if not, then we know at least, and then we compensate if there's a little asymmetry to start with, if one side needs a little more than the others. It does happen with the lips, but I feel that doesn't it's not as usual as some other places in the face. Most of the time the two sides of the lips are symmetrical. Sometimes the asymmetry is actually caused from the lip filler when we inject. Then we need to adjust for that and correct, and it's easy to correct, it's not a big deal. I always tell my patients as well, I usually don't do a very routine checkups all the time, but I tell my patients I'm always here. For the lip filler, again, the injection itself and the needle will cause a lot of swelling, so although we're injecting the same amount on both sides, we wouldn't know exactly how it look except after 2 weeks, a week, when the swelling and everything goes down. Then the filler will stay there, and then we'll see, make sure that everything is symmetrical, and usually it is in like 90-95% of the time. So I tell my patients there's a very low chance. If you feel one side is not the same as the other side, let me know. And I like to warn you as well, when you examine the patient, to do like almost from the front, not from the angle, because honestly, like I was looking from this angle, I felt that this is lower, but then when I came here, okay, I feel both sides are good and the same, so that looks good.